Behind me is Center Street. This has a lively reputation of a lot of student activity, largely students from UWM who take advantage of the inexpensive housing in River West and migrate and commute over to the UWM campus across the river. The second part of the cycle of COPC is helping a population define its shared health problems. You know, as a physician, we're oftentimes in the belief or the disbelief that we know what's wrong with our patients. We know what's wrong with the community. Sure, I can point towards any number of databases that show that asthma, diabetes, obesity, chemical dependency, or what have you, is a big problem in any given neighborhood. However, if you were to go into those neighborhoods and start talking to them about those problems, many times the population isn't interested in hearing about it because they're interested in something else. And unless we ask those populations what's going on in their lives and how we might be able to help, they're likely to turn a deaf ear when we start talking to them about issues that might affect their care. And frankly, that's one of the fastest ways in which physicians fail when they enter a community setting, is they go in like a bull in a china shop and start pretending they know everything. So one of the first things a physician needs to do after the population is defined is actually listen to the population and listen to what that population is telling them is wrong. And you can do that in a number of ways. You can do that in focus groups. You can do that in a survey setting. You can do that anecdotally, man on the street type way. But you need to listen and you need to start gathering information before you presume you know what you're talking about. You can take the information the community gives you and you can partner it with other health demographic data, such as your census data, your public health department data, your emergency room data from the local hospitals, etc. But you really need to take a very healthy perspective on what the community is saying, because ultimately they're the ones that you're going to be working with, and they're the ones that are going to have buy-in with whatever it is you bring to them. So if you identify a health issue in which they are truly involved with, or in which they have a true investment in, there's going to be a much higher buy-in and a much higher retention rate to the eventual health solutions. And that's going to be the third step that I'll talk to you about next.